Welcome back to the Bronx Journal. I'm Miguel Perez, and we're talking with Tracy Callender, and we're finding out all about how we're combating HIV/AIDS in the Bronx. And BAS is a very important part of that. Just tell us some of the services that are available. How do you deal with people over there?
Okay, we have a wide variety of services in each department. We have a case management department who each social worker, each case manager gets a client and they follow through with, okay, you've been tested, now what? Do we have treatment, access to treatment? We can get them involved in some of our other programs as far as the nutritional counseling, because a lot of times that's a big issue with those that have been diagnosed with HIV/AIDS.
What about psychological counseling once they get this big news?
We definitely have resources available for them. We don't necessarily do the counseling on site, but we have other organizations that we partner with.
And other services, what can people expect from the agency?
Okay, we also, a lot of times you have some discrimination that's involved, or people that no longer can afford to stay in their housing, things like that.
And you go out and fight for them?
Yeah, we have a legal team that goes out, and we have a legal advocacy services.
So if somebody has HIV/AIDS and all of a sudden his landlord is giving him a problem, you go out and defend him?
Yes, we would use our legal team to figure out what exactly it is that we can do to help this person stay in their home.
How many people are involved in your organization? Is this all employees, or are there volunteers as well?
Oh, we definitely have volunteers. I'm one of 88 staff members, both full-time and part-time.
88 in the Bronx?
88 in the Bronx.
Wow.
For Bronx AIDS Services. And then we have a team of volunteers. We have about 40 volunteers. And each program has, well, not each program, but a lot of the programs have peers. And for us, for Go Girl, we have right now 13 peers that go out into the community and help us do things as far as outreach is concerned and getting the word out.
So let's say that you have a community activity that you're organizing. What would it involve?
It involves a lot of different steps. We have a lot of connections to other community-based organizations. So if I'm having a community event, I would definitely want to sit down with some of the other program coordinators that are involved at BAS, sit down and brainstorm and figure out.
So like there are community agencies that have their own location but don't necessarily deal with AIDS.
Yes.
You come into those agencies and give a presentation?
Yes,
I see.
We go into schools, we go to community health fairs. There's always community health fairs going on. So we go to community health fairs, and we go basically anywhere we're asked to go. We go and do presentations whenever possible.
Again, no charge.
No charge. Everything, all of our services.
It doesn't matter who you are or what your income is, or whether you're employed or not.
No.
You help everybody.
All of our services are free of charge.
And where do you get the funding for all of this?
Different programs are funded with different funders or grants or foundations. Go Girl happens to be funded by the SAMHSA grant and by the AIDS Institute. CDC funds some of our programs. So big government agencies a lot of times do it, but we also have some foundations.
Okay, and I understand you also have a theater group.
Yes, Go Girl has a theater group. Go Girl has a theater group.
And we have a video, so any moment now my producer is just going to roll that in as we're talking about it.
Okay. So Go Girl has a theater group. It's actually a youth-led, youth-produced group. They write all their own scripts, and they go out into the community, and we have different performances where we try to educate in an artistic way with the girls in the community. So it's
but the plays or the presentation that they give is about AIDS?
Yeah, well, yes.
It's a message about AIDS.
It's a message about AIDS and the cofactors that go into it. So one of our performances that we're doing now not only deals with AIDS, but teen depression, teen dating violence, cutting, homophobia. We try to tackle a lot of issues with the theater.
When was your organization started, and who was it started by?
Okay, Go Girl was started in 2002.
BAS.
Okay, BAS was started in 1986 by a Bronx-based coalition that was fighting AIDS as it was becoming a bigger epidemic. One of our co-founders actually still sits on our board. So,
but do the AIDS patients become activists themselves? Do
definitely.
They go out and help out and belong to BAS and help out as volunteers?
Yes, many of our volunteers
decipher information.
Yes.
So explain to me give me an anecdote about a couple of patients
volunteers
that you know.
Okay, we have a few of our volunteers that they've come into the agency and they've had a positive experience, and they've obviously wanted to help out in the community. A lot of our outreach workers and some of our just behind the scenes volunteers happen to be living with the virus.
I imagine there's some kind of like support services among the patients. Do they communicate with each other?
Oh
share
yes, we
information?
definitely have support groups, and we have different sit downs with those that are living with HIV/AIDS in the Bronx.
So you bring them together to talk about their common problems.
Yes, we have support groups over at a lot of our different sites have them. I know that the prevention office has them, as well as the main office. We have them.
And what happens there? I mean, what kind of support do they give each other?
It's kind of like a group support system. We have a domestic violence, because I don't know if people realize, but when someone is diagnosed with HIV or AIDS, a lot of times domestic violence issues come up. So we have a support group for women that are experiencing domestic violence who also may have HIV/AIDS.
Well, how are they related? Why does one bring on the other?
It doesn't necessarily cause the other, but sometimes you may have a partner who wants to expose. Let's say you don't want everybody to know you have the virus, and they may use that as leverage, like, you're going to do this, so I'm going to go tell your job you have AIDS, or
oh my God.
Yeah, so it gets kind of sticky in those situations, and there's some abuse, verbal or physical, and we try to help out with that as much as possible with our legal team and our domestic violence
What
groups.
about sexual partners? One has AIDS, the other one doesn't. How do you prevent this from spreading between this couple?
Condoms.
Yeah, but I know, but the agency, how do you deal with them in terms of training them, in terms of advising them? I
think that as an agency, we promote safe sex at any point possible. Condoms. If we could, we would pour them from the sky.
Okay.
I think that when it comes to the decision between partners, a lot of times they involve their doctors in that decision. But we at BAS try to make sure that they're protected and in monogamous relationships, and try to stress the importance of not transmitting the virus.
So, free condoms, is that a good
Yes.
idea?
Yes.
Put them out everywhere?
Yeah, I mean, we don't jam them down people's throat, of course, but we like to keep them available for those who may be embarrassed to go to the store and get them themselves, or sometimes condoms may be cost prohibitive for some of the population.
So how stupid are people who say, I don't really need it nowadays?
Pretty, not just, I don't want to call them stupid, but just not really that smart.
Right, okay.
When it comes to protecting yourself, I think that sometimes in monogamous relationships, people make that decision, and I'm not here to judge those people, but I think it's important to keep yourself protected.
Well, if you have two people who have a monogamous relationship and have been tested, then it's safe.
Yes.
They don't have to use condoms, right?
No.
But then they can't fool around either.
Yeah, and I think it's hard because, especially since I work with young women who aren't married, it's hard to say, yeah, if you and your boyfriend want to be monogamous and you're 16, how likely is it that people are going to be able to stay monogamous?
Listen, I think you're doing a wonderful job. We're very happy that you were here with us. This is great information that we're giving out the folks at home. And so thank you very much for being on the program. We really appreciate you being here.
I appreciate it.
Thank you very much. We'll be right back.